Thank you for joining me to discuss pain and fatigue in scleroderma. The outline of the talk will include understanding pain, pain in scleroderma, managing pain, fatigue and scleroderma, and managing fatigue. Last year, the International Association of the Study of Pain published a revised definition of pain, and it reads as follows. Pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. They reported that pain is a personal experience. It is unpleasant, therefore, it is also an emotional experience. It is experienced differently by everyone. Through life, people learn what pain is. Individuals' report of their pain experience should be acknowledged and respected. Pain can be due to various circumstances. Pain can start from outer tissues, such as skin, muscles, internal organs, such as appendicitis pain or lung pain, nerve pain, for example, sciatica pain or carpal tunnel syndrome. Pain affects every one of us at some point in the course of our lives. It is caused by different things and events. It also appears in various ways. For example, it may be sudden, twisting, throbbing, dull, or sharp. It may be intense, mild, or moderate. It may last a long time or a short time. It can cause significant distress and disability for the affected. Pain should not be under-addressed or under-treated. Pain treatment is a human right. Pain may last a short time, which is acute pain, or a long time, which is chronic pain. Acute pain usually appears suddenly and it lasts for 3 to 6 months, caused by something specific, such as an injury, whereas chronic pain is ongoing for more than 3 to 6 months. It may have started as acute pain, then it continues even after the primary injury has healed, or it may be pain that developed due to an illness, then it gradually continues for a long time. Chronic pain is most common in people with long-term conditions. It affects 20% of people globally, and it was estimated 4 million people lived with chronic pain in UK in 2015. Causes of pain in scleroderma vary. Skin thickening causing skin sensitivity, contractures, skin tightening causing difficulty and pain in mobilizing or moving. Joint pain caused by arthritis. It may be rheumatoid arthritis or osteoarthritis or even foot pain. Overlap syndromes such as Sjogren's syndromes, myositis may cause pain as well as calcinosis. Ulcers such as digital ulcers, skin ulcers, internal organs such as gastrointestinal problems, and Raynaud's phenomenon also causes pain in scleroderma. We should not forget other injuries that can happen or other illnesses that can be experienced by people with scleroderma as well, resulting in pain, as well as emotional experience that is experienced when somebody is diagnosed with scleroderma. Pain is common in scleroderma. It can affect functionality, mental well-being, as social adjustment, as well as quality of life. This is evidenced by research that has been previously done. The Scleroderma Patient-Centered Intervention Network investigated pain intensity and interference in 2,157 people with scleroderma. They found that 1,870 of these patients had some manifestation of pain. Pain should be addressed. Pain may affect physical functioning and influence psychosocial functioning because of negative effects. A study conducted by Johns Hopkins on 142 patients with scleroderma showed that 62% had mild pain, and it had affected their physical functioning as well as social adjustment, which are part of health-related quality of life. In different studies, pain has been linked to physical functioning, sleep problems, depressive symptoms, fatigue, reduced quality of life, and work disability. How do we manage pain in scleroderma? Communication is very important. Speak about your pain to healthcare professionals, for example, rheumatologists, specialist nurses, GPs, practice nurses, physiotherapists. Talk about your pain so that investigations that cause pain can be investigated. For examples, x-rays or ultrasounds can be done for joint pain. You can be prescribed pain relief medication, which can span from over-the-counter paracetamol to morphine-based medication. Your medications could be increased or adjusted, for example, Raynaud's medication or medication for reflux. I am aware that some people have side effects from medications, but it's about trying different medications sometimes to see what suits you and what you find helpful. You can be advised, for example, to be referred to other healthcare professionals such as occupational health therapists or physiotherapists, or even for orthotics, for insoles, and other supportive therapies such as pain management services. Talk therapy is also important, having counseling for the diagnosis of scleroderma itself. And you can also self-refer yourself. There are services such as improving access to psychological therapy services. I'll talk a bit more about them later. And you can also you can have behavioral therapy such as cognitive behavioral therapy, relaxation techniques, meditation, or even mindfulness and other psychological therapies. We'll move on to fatigue now. What is fatigue? Fatigue is burdensome to a lot of people affected. There is no consensus definition of fatigue. However, it can be explained as extreme mental and physical exhaustion. The occurrence and perception of fatigue is personal, therefore it is different for everyone. It can be disabling. The prevalence of fatigue is varied across worldwide. In a UK survey of 2,474 adults in 20 GP practices, 50% with chronic diseases reported having fatigue. There are so many words that people describe fatigue. These are some of the words, but they are not exhaustive of those. So exhaustion, tiredness, lethargy, malaise, run down, sleepiness, washed out, overtired, listlessness, lack of energy, physical weakness, running on empty, worn out, and over-weary. Just some of the words, but there are even more. Fatigue is invisible. It is not something that can be seen. Its effect can slightly be seen on the surface, like this iceberg, but the impact of it is much more for the affected person, and that impact cannot be seen by other people, only felt by the person that is affected. It is also subjective. the way I'm experiencing fatigue is different from another person's experience of it. It is different from muscle weakness, such as myositis, but people with fatigue also feel muscle weakness. Therefore, that's why it is important for it to be investigated. It is unpredictable and can start any time of the day. If it lasts more than 6 months, it is known as chronic fatigue. It is caused by different things such as anemia, thyroid problems, iron deficiency, viral infections such as COVID and other infections, difficult emotions, sleep disorders, cancer, and it is common in diseases such as liver diseases, scleroderma, multiple sclerosis, rheumatoid arthritis, Parkinson's, sarcoidosis, and other diseases as well. So you can see that so many things can cause fatigue. Fatigue is associated with mental well-being disturbances. For example, lack of motivation and interest, decreased mental function, and low productivity, not able to concentrate or to focus or even to think, as well as mental exhaustion and depressive symptoms. Physical interference in terms of feeling weak and reduced physical function. The effects of fatigue are sleeping a lot, difficulty in sleeping, struggling to do simple things, lightheadedness, losing interest in usual activities, as well as feeling dizzy in some people. Fatigue is a distress and disabling in scleroderma. Other factors associated with greater fatigue in scleroderma include pain, sleep quality, functional impairment, also breathing problems, severity of gut problems, and also it is reported greater fatigue in diffuse scleroderma patients. However, we do not discount those with limited disease as well because they also are affected by fatigue, but it has been reported that greater fatigue is experienced in diffuse patients. This shows it is common in scleroderma, and this is evidenced by previous research that has been done. A survey which included 537 patients from 5 European countries, which included UK, Netherlands, Switzerland, Spain, and France, found that 76 to 96 patients with scleroderma had experienced fatigue at some point in their disease course. 63 to 94 of those patients had moderate to severe impact. Another Canadian study reported that 89 participants in their study had fatigue at some point, and 72% described moderate to severe impact of activities of daily living due to fatigue. A systematic review found that the fatigue ratings of those with other rheumatic conditions and patients undergoing cancer treatment were the same as patients with systemic sclerosis in terms of fatigue ratings. Sandusky did a study investigating frequency of fatigue and its impact on physical and social functioning in 107 participants. They found that 76% of those participants had been affected by fatigue. 61% of the patients reported fatigue as one of their 3 troublesome symptoms. Higher levels of fatigue were related to greater pain, poor sleep quality, greater depressive symptoms, and lower physical functioning. Fatigue and pain are determinants of physical functioning of scleroderma patients. How do we manage fatigue? talk to healthcare professionals so that investigations can be done for possible causes of the fatigue. Disease-specific treatments may be required, for example, in treatment of anemia. Physiotherapy is important for people with fatigue to be advised on energy management skills and also gentle exercises. Exercise training such as in Tai Chi might help because it's gentle exercises, it's not vigorous. Other managing approaches are talk therapy, counseling, maybe to help deal with having a chronic condition such as scleroderma, as well as the self-referral through improving access to psychological therapies. At the end of the talk, I will put a link in the chat for people who are interested in self-referring themselves to some of these therapy services. Behavioral therapy, for example, relaxation, mindfulness, cognitive behavior, and meditation might help as well in dealing with fatigue. The 4 Ps, problem solving, planning, prioritizing, pacing are important in managing fatigue. Problem solving is about realizing things that make you feel overtired or that contribute. For example, if you find going for food shopping really tires you, then you can solve the problem by maybe shopping online and having the food delivered outside your door. And also planning is important. Just because today I'm feeling great, I've got energy, I'm not going to paint the whole house, because if I paint the whole house, I know that maybe in 2 hours or 3 hours, I'll be slammed and I won't be able to do anything because I'm already overtired. So maybe I might decide I'm going to paint half of a wall or something like that. Prioritizing on what to do is important as well. Even when you start the day with energy, you have to prioritize what you're going to do, because if you overdo things today, maybe in the next 2 or 3 days, you'll be lying down because you're overtired, you can't do anything. Pacing is very, very important for people with fatigue. Pacing yourself, not overdoing things. Lifestyle changes such as good sleep hygiene also helps, as well as healthy diet. Support groups cannot be underestimated because they are places or platforms where people can share their experiences and also provide tips on how to cope with conditions such as fatigue. Other management approaches include self-help approaches, such as the positive coping with health conditions. It's a free workbook that you can download, and it teaches on skills to manage various stressful situations related to living with a long-term condition such as scleroderma. It also teaches skills in coping with pain, sleep, physical activities, and others. Self-management approaches also are helpful in coping with having a chronic condition such as scleroderma. These scleroderma patient-centered intervention networks, SPIN, are developing specific self-management tools for scleroderma patients, which are coming into the near future. In summary, pain and fatigue are common in scleroderma. They are both associated with function impairment, sleep disturbances, and depressive symptoms. Communication is very important. Everyone is an individual, therefore they should receive individualized care. Pain should be controlled or alleviated, and fatigue should be investigated. Do not suffer in silence. Talk about your pain, talk about your fatigue to healthcare professionals, and also find ways to self-manage these complications. These are just some references that I've used to help me come up with this talk. Thank you. And I'll stop sharing now and we can go on to questions if there are any.
Thank you, Tani, for that really interesting and informative talk. I omitted to say before you started, if anybody has any exciting, interesting questions for Tani, please put them into the Q&A, and I will be fielding questions and raising them with Tani as they come in. So to kick off, Tani, I suppose one of the things I found really interesting is you mentioning IAP therapies and talking therapies and self-referral. I guess people, you know, with the sort of strain on sort of mental health services within the UK in general, people be interested in how they could access these. Could you give people any pointers, please?
Yes, so the NHS England or NHS UK have got a website that are specific for self-referrals for psychological therapies. So I can put a link right now in the chat where people can go. Every area, as in every city or and sometimes every borough have got these services where people can actually where they can actually self-refer themselves. I'll try and put a link.
What you could do, Tani, if you're having trouble, you could just share it with SRUK, and perhaps we can find some way of getting it out to the webinar attendees afterwards.
Yes. I think that would be good. Yes, that would be good. And also, I will provide a link for self-management services as well that people can access. It is very good to access all like the self-management so that you actually learn how to manage your scleroderma. Although when you go on the site, they talk about, you know, the common conditions such as diabetes and others, but you shouldn't be deterred by that because some of the subjects that they talk about are general. So you should pursue that. And also I'll put a free link for the workbook on positive thinking on managing a chronic illness. So it's a free download. People can just download the workbook and work towards it.
Thank you, Tani. That sounds like it could be really helpful resources for people. So we have a question from Julie who asks whether there's any extra support for young people with scleroderma. She says her son is 23 and was diagnosed 10 years ago and he struggles.
I'm not sure if there is a support group for young people with scleroderma, but I think it's a very important point because for a long time, I mean, it's not a new question. For quite a long time, people have been asking if there are any support groups that are actually specific for young people. I'm not sure if there are any yet, but I think it's something that we need to think about in the future. But I know that there are lots of support groups across the country that support people with scleroderma.
Yeah, that sounds like the job for SRUK actually. Obviously, we've got the ones for families, but that's sort of more for sort of younger people, you know, children with scleroderma. So maybe that's a niche for us to sort of do a group for under 30s or exactly. With very different challenges to perhaps some of the other support groups. So that's an idea for me to report back. Okay, so we have another question's just come in. So this person unfortunately had COVID at the beginning of the year, and she's experiencing, or he, that they fatigue and increased pain in their joints. And they wanted to, they're basically concerned whether this is long COVID or general issues with their scleroderma, and some advice of what they should do.
It's very difficult when somebody has had COVID and also they have scleroderma. Therefore, I think it would be important for this individual to actually talk to their healthcare professionals, like, for example, their rheumatologist, so that investigations can be done, because to find out what is the cause of the fatigue. And if everything is eliminated, we can put it just to be maybe it's the COVID, it's the long COVID, or it is just scleroderma. And it is it's a bit difficult to differentiate, because how were they before they had COVID? Did they have fatigue before COVID, or fatigue was there and now it's added on with the COVID, which would be a combination of the two? So I would urge them to seek help with their healthcare professionals.
Thank you, Tanya. Yeah, that's a really interesting point, isn't it? Because that I was actually wondering too whether how sort of fatigue would actually, following COVID, would actually sort of affect people with chronic conditions like scleroderma, and how it could sort of contribute to what was going on in the background before. So yeah, that's a very relevant point.
Yeah.
So we have another question, and this again, I'm assuming that it's a lady, and I could be completely wrong. It might be a man. What I find the hardest is getting my partner to understand and have some empathy. And so it's how can you communicate your fatigue and your pain and the effects that they have on you to your partner or the other people in your life?
I think the most important thing is, do they actually understand, do the relatives or the partners, do they actually understand what scleroderma is? Because the starting point is for them to understand what scleroderma is. Scleroderma is just not like any other condition, the general condition. It is rare and it affects people differently, and it's got so many comorbidities. So the important thing will be for them to understand scleroderma. If they can understand the scleroderma itself, then they will be able to understand the burden that comes with being diagnosed with scleroderma. And I think if they understand the scleroderma, they will be able to empathize with what the other experiences that you are having due to having the scleroderma. It is very difficult for people to understand scleroderma, but you as an individual, you need to understand your scleroderma to be able to explain to those people, also to signpost them to platforms such as the SRUK for more information on the conditions, so that they will be able to support you through what you're going through.
That sounds like a really valuable point. And, we've got lots of great information on the website about how scleroderma affects people, and, the effects on the various organs of the body, and how this then contributes to general overall well-being, or a lack or a decrease in well-being. So yeah, maybe the combination of the two could help. Wish you all the best for that. So we have a question from Alison, who's saying that she has a great deal of trouble sleeping and finding that the pain is mostly at night or when she's not moving. And she asked if you can suggest something that might help with this.
So firstly, have they have they been investigated about their pain? Have they talked to a healthcare professional about their pain? That is the first thing. Then if there is anything that needs to be done about the pain, for example, if they need pain relief to be taken at night, then that can be suggested. But the first point is to talk about it and to find ways on how to cope. And then the other things, simple things that you can do yourself is like what I suggested, the behavioral therapies, you know, like such as the relaxation techniques, learning about that, or even cognitive behavioral therapy can help as well, because it changes how you think, how you see things, and that can have an effect on when you are going to sleep. Because right now, maybe when it's sleeping time, you are scared to go to sleep, or you are anxious to go to sleep, because you know when you are not moving, that pain comes back, and it's quite a lot. So if you have a different way of thinking, or even if you see a physiotherapist to learn on what you can do, while you are sleeping. Of course, you are not able to move around, as in wake up and move around and then come back and sleep. But what you can do while you are sleeping to help to ease that pain, it might not completely go away, but there are some things that can be done just to alleviate it a bit.
Thank you. That sounds like it's really helpful advice. We have a question from Lindsay, who has a diagnosis of mixed connective tissue disease. And she was saying that in general, this means the principal symptoms of scleroderma lupus are less severe according to the doctors. And she's concerned about whether this also applies to pain and fatigue, because she feels embarrassed to ask about it overall if she feels that she shouldn't be that bad.
Oh no, don't feel embarrassed. There is no need for you to feel embarrassed. We are talking about this talk today because we want people to talk about their pain. We want people to talk about their fatigue. Therefore, even if with mixed connective tissue disease, you can have these challenges and they can be burdensome in your life, and we want your quality of life to be improved. Therefore, next time you go and see your rheumatologist, talk about your pain, talk about your fatigue, because they can be investigated. So as I was saying, it's important for you to talk about it because there are other causes of fatigue. It's just not having the scleroderma itself would cause fatigue. There are other things. So sometimes it's a game of elimination to see, is there something other than scleroderma itself or the mixed connective tissue disease itself that is causing these problems? So that's why it is important for you to speak about. Please don't feel embarrassed to talk about it. Talk about it.
Thank you, Tani. That was a great answer, and I was suspecting there would be an answer of that sort. I really hope that helps you, Lindsay, and encourages you to talk about it with your doctor. I've got a question from Kyle, who says that he's suffering from fatigue that's affecting his work. He mentioned to his rheumatologist, he talked about it to his rheumatologist last week, and he was told that there was nothing in the most recent blood results. So, you know, there wasn't any sort of inkling that the conclusion was there was nothing to do with his scleroderma. So Kyle is feeling a bit stuck. He wants to reduce hours at work because he's mentally and physically exhausted, but at the same time, he can't afford to cut his hours. Would you have any advice you could offer to somebody in his predicament?
It's very, very complicated, isn't it? Because the healthcare professional that talked to you, if they said there is nothing that is causing the fatigue, it might be just because of having scleroderma might just cause fatigue. So it doesn't necessarily have to be another cause. There might be another cause, but not always. just having the scleroderma can cause fatigue. Therefore, those things that I was talking about, being referred, you can talk to your GP to say, can I have a referral for physiotherapy, so that maybe they can teach you on energy management skills. You can also self-refer yourself to the services, the psychological services that I was talking about. And also for your employer, do they understand about scleroderma as well, how it affects individuals and what it is? Because I think if employers understand the conditions itself, then they can empathize with that. I'm not saying all of them will, but you have to try. You can take your SRUK book on scleroderma for them to actually understand this is what I'm going through. And it's not only about the disease itself, but about the other challenges that come with it, such as fatigue, such as pain, and all the other comorbidities that come with the condition. And probably they will understand. But the thing that you are not able to reduce your hours, that's also difficult to deal with, isn't it? Unfortunately, I don't have any answer for that, like how it can work out if you are not able to reduce your hours. But I think speaking to your workplace would be important, so that they understand your conditions and find ways that they can help you.
That's a very relevant point, actually, that Tanya's made, Kyle. And on our website, we do have a guide for scleroderma that's been developed for employers. So, we can, you can have a look it's in the information section on the website. It's like a sort of PDF booklet, or, you can touch base with us. You can send us a message and we'd be more than happy to send that to you. Another thing that we can do is we can write letters for employers as well to help reinforce what's in the booklet and explain about, what scleroderma is and how it affects the individual. So again, that's something that we can help you with should you need it. But, I hope, you got some sort of advice from Tanya about some other things you could be doing as well to help you manage the sort of fatigue. And between us all, Tanya's advice and SRUK, we can help you with this as much as we can. Gosh, we've got a few more questions coming in. So we have this person doesn't give their name. So she, again, I'm assuming it's a she, it's a lady. This is sexism at play. How does the Royal Free Hospital Scleroderma Clinic help patients with pain and fatigue, or is it left to GPs?
That's a 101 question, because we are a tertiary hospital. So sometimes what might happen is, if it's somebody who is also seen locally to their area, if you talk about your pain and your fatigue in the clinic consultation, then most probably they can write a letter to either your GP or your local consultant for something to be done. There is chronic pain services at Royal Free. So for people that are at Royal Free and they are only seen at Royal Free and it's their main hospital, they can be referred to those services, or even physiotherapy, they can be referred to that. And also it's about the individuals liking so far. So some people want everything to be done at Royal Free, so it will be done at Royal Free. But if it's somebody who's coming from afar, for them to come for chronic pain services when at their local hospital there is such a service, it doesn't make sense. They can be seen locally, and probably it might be easier or sooner when they can be seen than at Royal Free. But the important thing is, are people talking about their pain and their fatigue when they are seen in the clinic? You need to be talking about that.
Thanks, Tanny. So we've got one question that's a bit linked to Kyle's question about can your consultant or specialist help you if you feel your pain or fatigue are affecting your work?
Okay.
So would you have anything to add on to what you sort of, is there anything else that somebody could do other than talking with a consultant and being investigated?
No, I think what we discussed already is what they can do, and also seeking help from SRUK, the information about the employers to understand. Because sometimes if we do not voice things, as I was saying, fatigue is invisible, pain is personal. So if you don't talk about it, people won't know, people won't understand. But if there is information, if there is backup for what you're going through, then employers should understand that this is what you're going through. It might not be invisible, but it is happening. So I'll just divert a bit. We, at one point, quite a long time ago, we were having problems with some patients of ours were not able to get transport to come to the hospital, and they have scleroderma, and maybe they had like diffuse scleroderma, and it's difficult to go on the underground or to use the train, because if somebody knocks them, like you know how fast-paced London is, and if somebody knocks them, they are going to fall and they won't be able to get up. So we had to fight for patients to get transport, even though it didn't fulfill the criteria. They had a criteria for transport. We had to talk to transport to say this form doesn't work, because you might see somebody with scleroderma and you don't see the effects of it, because they are just seeing you as a human being. They might see the tight skin, but they don't know the effects of that tight skin, that if somebody knocks you over, you're just going to fall down. So sometimes it's about, you know, like you have to go above. Even your healthcare professionals, they have to go above for things to be understood in scleroderma. That's the complication of scleroderma. People have to understand what it is, and people still don't understand what it is. So we need to be talking more about it.
Thank you, Tanny. So we've got a question from Edith, who also said thank you earlier on for your comprehensive overview of the topic. But Edith has asked whether the combination of Sjogren's and scleroderma makes fatigue worse, because she's been recently diagnosed with Sjogren's, and she feels that her fatigue has worsened.
It might. I know that fatigue is associated with other overlap syndromes, so it might have increased that, but still the way to manage it is still the same. And also, I would also encourage you to get investigated what the cause of that fatigue is, because we might put it to be just Sjogren's, but maybe there are other causes that has not been investigated. So once other things have been investigated and they are fine, then we can put it to be having Sjogren's as well as the scleroderma.
Thank you, Tanny. So I think there's a couple of more questions, or there's still a few coming in. So we have a question that's linked to the menopause, and well, I could say it's a lady in this instance. She sort of found that the pain and fatigue she experiences is magnified during these hot flushes, and she's wondering whether, well, basically what the reasons are, and I suppose what she could do to try and help.
I'm not really versed in menopause and pain and fatigue, but I'm not discounting that it can exacerbate those symptoms. But I think it's something that maybe you should talk to your healthcare professional about. I would think the treatment or the management of it will still be the same. And also, maybe you might need some other treatment to manage the menopause as well. But I would urge you to talk to your healthcare professionals about it.
Okay. Would you recommend? This is a question from somebody who hasn't left their name. Would you recommend any vitamins or supplements that could help with fatigue, or do you think this is again something that somebody should discuss with a prescribing doctor?
I think it's something that somebody should discuss with their prescribing doctor, because there are vitamins that are out there that are prescribed for energy and stuff like that, but this is like an individualized thing, so you would need to talk to a healthcare professional.
That's very sensible advice, and plus, there's the fact that certain supplements can interact with medication.
Exactly. Yeah.
So I think that's something that anybody should talk to their prescribing doctor before they try.
Yes.
Self-help through supplements.
Yeah.
So we've got one last question, and I think if no other questions come in, we might sort of wrap up after this one. So this is a question from Wendy, who asked whether you think that general healthcare professionals understand the fine details of the impact of scleroderma on people. And she sort of asked, how do we educate our healthcare professionals to take complaints seriously rather than brush them off?
That's difficult. That's a difficult question, but I think it's about you pushing through, not giving up, because of course a lot of people, even a lot of healthcare professionals, don't know about scleroderma. But having that information, as in you having a book from SRUK about scleroderma and going to your maybe practice nurse with it and giving them for them to have it to read. Some people will be surprised that you've brought them a book, but you're not doing it for them, you're doing it for yourself. That next time when you come, they will know what you're talking about and what you're going through. So sometimes I think it's up to the patients actually to educate the healthcare professionals that they are seeing, if they are not taking interest or they are not showing interest in the condition itself. So take them SRUK booklets on understanding scleroderma so that they can read on it.
Thank you, Tani. Well, I think there are no more questions at the moment. So I think this means we can probably end the webinar slightly early. On behalf of SRUK and from myself personally, I'd like to say thank you to Tani for a really great webinar and great Q&A session afterwards. And thank you all for attending, and all the best for the rest of your days.
Thank you. Thank you for listening.
Thank you very much. Bye-bye.
Bye.